In the second lecture of the playlist Anatomy Flashcards, the skull view we will discuss is the lateral skull view. So, in this, we have 9 labels and see what are these labels and what is the new thing we will discuss. So, let's start. Very important, very interesting playlist. You have to master this. The first label you can see here in the green, this is the parietal bone. The first label, all this, the green area is the parietal bone. The second, you can see it's represent the suture. This you can see it represent the suture. This is the coronal suture. The coronal suture divides the body into the front half and the back half. This you can see, if you divide this like this can divide the body into front and the back. This is the coronal suture. The third label you can see in the yellow, what is this? This is the sphenoidal bone. It's also called sphenoid bone. The fourth label we discussed this also in the previous lecture, and from the lateral view this is more clear. You can see it is the lacrimal bone. And the fifth, this also discussed in the previous lecture. Here the upper teeth attach, I told you this is the maxilla. This is the maxilla. And the sixth label you can see in the light orange color, peach color, this is the zygomatic bone. This also discussed in the previous. So in the lateral view these bones are more clear. First label is the frontal bone. Second is the coronal suture. It joins the two bones, frontal and the parietal bone. This is the frontal bone, this is the parietal bone. It joins these two bones. This is the coronal suture. The third one is the sphenoid bone. Fourth is the lacrimal. Fifth is the maxilla. And the sixth one you can see in the peach, this is the zygomatic bone. And the seventh label, where is, here it is, this is the occipital bone. It is present at the back. So this is the occipital bone. It's also called external occipital protuberance. If you remember, here the trapezius muscle attach. And the eighth you can see here, this label the also the suture. This is the lamboid suture. It joins the temporal and occipital bone. This is the lamboid suture. And the ninth one, these are 4 labels I think. See, here is in the pink, this is the temporal bone. It is above the ears. It is the temporal bone. Seventh one is occipital bone. Eighth is the suture, lamboid suture. And the ninth is the temporal bone. So I think it's very important, very easy. You should remember with me. And next we will discuss the comment that is very important. So discuss this. I will zoom it. This lateral view shows many bones of the cranium. Cranium means skull. And some of the sutures of the skull. Sutures joins the bones of the skull. The immovable fibrous joint between the adjacent skull bones. Fibers in the fibrous joint, there are, it's of 3 types: sutures, syndesmosis and gombosis. ठीक है? Okay. The coronal suture lies between the frontal bone and the paired parietal bone. This is the frontal bone, and this is the parietal bone. I told you before, coronal suture is between them and joining them. And the lamboid suture, the 8th label, you can see it lies between paired parietal bone and the occipital bone. You can see parietal bones are in pairs and temporal bone is also in pair. It is present on the right and the left. The pterion is the site of union of the frontal, parietal, sphenoidal and the temporal bone. Here is the area where the four bones attach: frontal, parietal, cephoidal, and the temporal bone, and it is the weak point. A blow or any damage to this area or a skull fracture in this region is dangerous because the bone at the site is the weak and the middle meningeal artery supplies the dural covering of the brain. So this is the weak area where any cause of blow can cause serious injury, and the dura covering, the brain has coverings: dura mater, arachnoid matter, and the pia mater. Brain has layers of meninges, lies just deep to this area. If there is any injury to this side, the middle meningeal artery passes through it and supplies the dural covering of the brain, just lie deep to the area. So this is the weak point. And astern is the site of union of the temporal, parietal, and the occipital bone. This is the area. This is the parietal, occipital, and the temporal, parietal, and occipital. Temporal, occipital, and the parietal bone. So this area is the astern, and the previous area is the pituitary. And the clinical we will discuss is the skull fractures. This clinical is very important. In this playlist we will discuss the comment, all the labels, and its clinical very briefly. In just 5 to 10 minutes you can get a lot of knowledge. Skull fracture may be classified as linear, have a distinct fracture line. It means clear fracture line. Linear means a straight line. The skull fracture may be linear. Skull fracture may be comminuted. It means it have multiple bone fracture. Depress if driven inward, which can tear the dura mater. Dura mater is the first covering of the brain, so it's destroy or damage first. Dura mater, then arachnoid mater, then the pia mater. And the third skull fracture is the diastatic. If fracture along a suture line, if there is a suture, it is along the suture line. Basilar fracture, a fracture of the base of the skull. The four fractures of the skull we will discuss. First is the linear, comminuted, in which multiple bones fracture. Diastatic, fracture along a suture line. And the basilar fracture, fracture of the base of the skull. A blow or any kind of tear to the pituitary may damage the middle meningeal artery, I told you before, or one of its branch may damage, which lie just deep to this thin area of the bone, causing an epidural or extradural hematoma. This is very important for MCQ's point of view. Injury to this area cause epidural or extradural hematoma. This is the, what is this? Extradural or epidural, bleeding between the periosteal layer of the dura and the overlying bone of the skull and the periosteal layer of the dura. This is the area of the epidural or extradural hematoma. I think I clear you this lecture. In this lecture I will discuss the skull lateral view from 1 label to 9. We will discuss all the comments, that we will discuss the important points and also the clinicals. Here we can, this is the lecture almost 10 minutes. Every lecture is almost 9 to 10 minutes, and we will discuss these things, very important things, in detail. Thank you so much. If you have any question you can ask.